There we go. So now we're recording. Thank you so much for joining us. I'll hand it over to my colleague Nazreen to get started.
Yeah. Hello, everyone. So some housekeeping rules before we begin. So we invite you to rename yourselves, where you are calling from, and or your affiliation. Please use the raise hand feature or ask your questions in the chat. We will be monitoring the chat. And since we are a small group, so please feel free to unmute yourself. We will dedicate time also for Q&A later on. Most importantly, we hope you enjoy this conversation and you will learn something valuable from it. We sincerely thank you for taking the time to join our session. So about the agenda. So our agenda today is in 3 parts. We will open the conversation with an overview of the Global Disaster Preparedness Center, main knowledge management vehicle. We will talk about the GDPC and also the knowledge management strategy and how we approach that. Then we will discuss the process and challenges in creating and maintaining different resources in response to the COVID-19 pandemic. We will listen to 2 successful use cases and ponder upon the lessons learned, and they were many actually. So, and finally, we will share our vision for the future of knowledge management. Again, we hope you will have a delightful time in our company, as it is a pleasure for us to present today.
So there'll be 4 of us speaking today. My name is Jessica Ports-Robbins. I'm the Technical Advisor for Preparedness ICTs for the Global Disaster Preparedness Center. You've just heard from my colleague, Nazreen Ayouti. She's the Knowledge Management Consultant at GDPC. And then we will have 2 speakers to talk about the use cases. Bonnie Haskell, also a Technical Advisor at GDPC, and my colleague, and Dr. Lauren Clark from the health team at IFRC. So that's who you'll be hearing from today, and we're happy to share our experiences with you. So first, we're going to introduce our Prepare Center website, which is GDPC's, the focus of GDPC's knowledge management. For those of you who may not be well-versed in our Prepare Center website. So Nazreen, hand it over to you to talk about KM.
Thank you, Jessica, and for a lovely introduction. In this part, we will be talking about something that I am personally passionate about, which is knowledge, and more specifically, knowledge management. So if you search knowledge management on the internet, you will come across numerous definitions. I picked the one that you're seeing on the screen because it has the word conscious, and we will get back to that word later. It's a very key word, I think. So knowledge management, for those who are not familiar with the concept, is the conscious process of effectively collecting, sharing, maintaining, or managing and deploying organizational knowledge. As you see, it's a very succinct definition, but yet it has so many verbs and words in it. It's an interdisciplinary area of expertise. And hence why the word conscious is very important here, because we need to be conscious. It's a conscious effort, and having a knowledge management consultant or manager doesn't solve the issue if there is an issue in the first place, but it actually requires a team effort and an organizational, a learning organizational culture to have good knowledge management. I will not talk too much about the theory, and now if Jessica, you can move to the next slide, please. So at the GDPC, these are our 3 main areas. So knowledge management is a core service, and a core service. So as an IFRC reference hub, we deliver knowledge management as part of our services. And also in our knowledge management system, because knowledge management has several systems in it, and it's not only information management, but a part of it, our main vehicle is preparecenter.org, and we will be talking about it later. And as I mentioned earlier on, it is a conscious effort, because this is having good knowledge management requires good partnership building skills and also a good collaborative team spirit. And we will see that more later on, that when Dr. Lauren Clark will talk about the experience with the I4C Health Help Desk. So moving on, I think it's you, Jessica, now.
Yeah, so I want to talk a little bit about how we got to the place that we are with Knowledge Management and Prepare Center. Prepare Center has been a website that GDPC has used for many years as a knowledge management platform. However, it just so happened that in early 2020, we were undergoing a complete rebuild of the Prepare Center website based on user feedback, based on the evolution of technology and the evolving needs based on knowledge management, changes in GDP structure, and a number of other factors. We decided to do a complete rebuild of Prepare Center. So the timing wasn't necessarily great when it came to the convergence with the COVID-19 pandemic, but it also provided a great opportunity. So it's interesting. There are definitely some challenges in the process and definitely some opportunities with the way that COVID-19 and this Prepare Center rebuild happened sort of at the same time in the early days of the pandemic. So I'll speak a little bit about the rebuild that we did. There were 3 main technical changes that we made to the Prepare Center website that impacted the discussion that we're having today about COVID-19, about the knowledge management and resource sharing that we were able to facilitate at that time. So the primary technical change, really the underlying change, was a change from Drupal to WordPress as the underlying platform of the entire website. And if you're not super familiar with, how websites are built, it's essentially just a different kind of software almost it's a different kind of code that the website is built on. So WordPress is one that a lot of people are familiar with. It also allows our team to do a lot more of the content management and editing and changing things ourselves instead of relying very heavily on a vendor. So because WordPress has become so user-friendly, our team was able to take on that responsibility of creating and updating and managing a lot more of the content instead of, like I said, instead of having to rely on our service vendor for all of the technical changes we needed to make. So WordPress was a big change. As part of that, we also introduced the opportunity to create microsites, and we'll define microsites a little bit more later, but essentially it's a way for us to host small sets of pages on our Prepare Center website that have the look and feel of a partner organization that might not have the need for an entire separate website of their own and just needs to host some content. And we were able to sort of extend the underlying structure and the storage capacity and the service, the support to be able to support some of our partners with microsites. So we'll talk about that a little bit more in just a minute. And then finally, we updated the kinds of user roles that were available on the back end of the website. So instead of just having an administrator on the back end, we also have different types of user roles like editors or authors or microsite managers. So we were able to differentiate how different users could log into WordPress and manage different pages based on their needs and based on what their access needed to be. So one of the things that's really important to understand about Prepare Center is that because it's designed to be a knowledge sharing platform, it's based on a really robust structure for that. And so I'll hand it back to Nazreen to talk about our resource library.
So thanks to the technical capabilities of WordPress that Jessica just introduced now, our resource library now counts more than 4,000 resources in several languages. And we also have this capability on our website, which is having the capability of translation. So when it's web pages, and in this instance, when it's a resource that is written in the page and not added as only as a PDF, the website you can pick whichever language you want. We have more than 50 languages, and it will automatically translate. So the resource library, it has a searchable inventory of documents that are mainly related to hazards and disaster preparedness, because that's our expertise as the Global Disaster Preparedness Center. And it's also crowdsourced, which means that users who have these capabilities, and that Jessica just mentioned earlier on, have the total autonomy and freedom to share their resource without needing someone as a middleman, without sending an email, without going through links to search for the person that they need to contact or submitting through contact forms. They just create a user account that needs to be approved, of course, because we check. that's something that needs to be checked. So we validate, we activate the user, and then we just review it very quickly. And if it's a resource that is useful to the communities, we publish the resource. Next slide, please. And now we will be talking about microsites, and Jessica mentioned that earlier on a little bit. So just a quick definition, and please don't be appalled by some technicalities. We're trying our best to make it as simple as possible. So a microsite is actually an individual web page, or like a small cluster of pages that are meant to function as a discrete entity within an existing page. So we have our main knowledge management vehicle that is preparecenter.org, but there are instances where there is a need for a specific landing page, or there is a need for a total branded, something that is totally differently branded for our own brand, and thanks to WordPress, we have that possibility. So these microsites are actually a small set of pages that mimic like a mini website. Think of it as a small landing page. They are hosted by a larger site. So our people who reach out to us, and our partners who reach out to us that need a microsite, they maybe don't have the resources, or they don't have the time, so they need our assistance and our technical and knowledge management assistant to set that up. And it's also more cost effective, and also it allows for custom branding and layout. And our partners, they have total autonomy and freedom. As Jessica mentioned earlier on, there are microsite editors, so they can brand it in the way they want. And we have several examples. So for example, we have microsites for social media for behavior change. We have an IFRC alert hub that talks about the common alerting protocol. And on another example, we have nature-based solution microsite, and many others that are actually in the pipeline, but stay tuned or visit our webpage and you will get to see that one. So next slide, please. I think it's you, Jessica. It's part 2.
Yeah, so that brings us to the second part. So now that you've heard a little bit about GDPC and our involvement with knowledge management and how Prepare Center fits into that, and how the actual structure of how we rebuilt the website helps to support knowledge management, I want to talk about how this converged with the COVID-19 pandemic and the opportunities and challenges that afforded. So it was in this context that we're talking about when the COVID-19 pandemic began. We're in the middle of rebuilding. Now, normally GDPC as a team is not really a response group. You know, we're the Global Disaster Preparedness Center. We operate a lot with the capacity building during blue sky mode with our national society and IFRC partners. But of course, when it came to the COVID-19 pandemic, everyone needed to focus on this. It's been such a massive challenge, and of a scale that we haven't seen before. So everyone in some way or another refocused some of their work toward responding to the COVID-19 pandemic. So with COVID-19, a great deal of information sharing needs, right? So IFRC teams were working constantly to develop guidance to help support national societies and others in the field to respond appropriately based on the most up-to-date information as possible. We know that there is a lot of misinformation that's gone around during the pandemic. And one of the things that was really important to IFRC was to be able to make sure that the content being shared, that the resources being shared, that all the guidance being shared was as up-to-date and accurate as possible based on all of the information available. So one of the first things that we did is we partnered with we partnered with the IFRC health team, and you'll hear from Dr. Clark in just a few minutes, who will talk about the health help desk from their perspective. But this was an early piece of work that we did on the quote unquote old version of Prepare Center while the new version was being built. So in early March, we partnered with the IFRC health team to get this health help desk established. It was from the green light of the project to it being live was less than 2 weeks. So it was a pretty quick turnaround in website time, but it was established within 2 weeks. It launched in the middle of March, right around March 15th. And soon after that, we also established a BCP help desk for business continuity planning. So both of these help desks are designed to help support national societies to adapt their operations based on the needs, based on health needs, and based on the critical role that national societies are playing in the pandemic, in the response of the pandemic. So we set up these help desks. They're organized as what we call toolkits on the Prepare Center website. So it's essentially a hub where we could host all of the information for each one of these topic areas. And we'll go into a little bit more detail on the help desk in just a few minutes, but that was one of the first things we did. It's also important to note, this is one of the challenges we had. It's important to note that we actually built 2 copies of each help desk at the same time. Because we were going through this rebuild of Prepare Center, we needed to stand these up as soon as possible. With the new Prepare Center website was not scheduled to be launched until World Red Crescent Day in early May. So we're going through the rebuild process, and we had to put up the information really early on. So we were building it on the old website. At the same time, we're building a tandem version on the new website to make sure that when we make that transition, that all of the content is there. So we were doing a little bit of double work just because of the situation that we were in, but that's just the way that it had to happen, but it was definitely a challenge. So after these help desks, we also ended up working very, very closely with IFRC on what we call the COVID-19 Compendium. This is our Prepare Center's first microsite. And it was really sort of proof of concept for the microsite based on the new functionality that we were building in on the new site. So as I said, all of this different information coming out of IFRC, all of this guidance for national societies, and the information needed to be available quickly and easily and to a variety of different places in a very accessible format. So we were approached by IFRC, and there's a long process involved, but essentially we offered to leverage the structure of Prepare Center as a repository for knowledge management, for documents, for resource sharing, and leverage that capacity to host that information and set up a microsite to make it easier for national societies to access those resources in a very organized and streamlined way as when they needed it. And as quickly as possible. So we needed a place to host dozens and potentially hundreds of resources on all aspects of COVID and how it affects Red Cross, Red Crescent work, including health and the blood supply, community outreach, national society management, migration, livelihoods, all of these different teams were preparing content and sharing it with national societies. So we stood up this COVID-19 compendium. It went live in early May. We went through a 3-stage approach in the way that we were going through this. So first, we needed to design the page, and we designed a landing page, and Bonnie, thank you, has just put the COVID-19 Compendium landing page in the chat, so you can check it out yourself. But we designed the landing page as a sort of a one place where you could see at a glance all of the different places that you could go to get information on COVID, that organized by topic. So from there, we then created individual page templates for all of the different IFRC teams that were sharing information. So CEA and migration and logistics, all of them have individual pages where they could share their guidance and their communications. That way we could keep the content organized and make sure that users are able to find the information they needed easily and quickly. We also migrated a lot of documents. They had been temporarily housed on the Go platform because the Go platform, as one of the technology hubs at IFRC, was sort of acting as a stopgap to try to have a place where there are a bunch of resources available. But the site isn't really built to be, this knowledge sharing platform, and it quickly kind of grew out of what was expected. So we took over that role, and we migrated dozens and dozens of documents into our resource library within a very short amount of time. The second stage was engaging with all of these different IFRC partners across all of the teams that were generating and sharing guidance. Engaging with those partners, establishing points of contact, making sure that they understood, how the website or how the microsite was working, how the compendium was going to operate. We conducted a great deal of training so that each one of those IFRC partners' focal points could log into WordPress and manage their own individual pages themselves. This is where the user roles come in that I was talking about before. So we were able to assign user roles to our IFRC partners so that they could manage their individual pages on the compendium without interfering with anyone else's, basically without interfering with anyone else's page. So the migration team had access to the migration page, but they didn't have to worry about accidentally accessing the livelihoods page or the education page. They were managing their own. And so that was a really great way for us to allow a large variety of partners to access and manage their individual pages and make sure that their content didn't have to go through us all of the time. As Nazreen said, if they didn't have to email somebody and make sure that person uploaded the content for them, they could go in directly, upload what they needed, regardless of time zones, regardless of where GDPC was and whether or not we were working that day, or if it was the weekend, they could do it as quickly as possible. And we conducted training with all of those focal points to make sure that they understood how all of that worked and how to build pages and how to make sure that their content was as updated as possible. And then we did some customization of topic pages based on the needs of those different partners. And then the third stage, which is still sort of what we're in now, is ongoing support. So we continue to support all of these different teams and the updating of information. There have been spikes in the time period throughout the course of the pandemic where there's been more of a need and less of a need, and we provide ongoing support as the teams need it. We've also done a few technical enhancements. We added the multilingual feature to the COVID-19 Compendium so that the content is available in all of those different languages. And we've been working on making sure that the data coming out of our analytics for the website is able to support the teams and help them understand how people are engaging with their content. Just a couple more notes, and then we'll hand it over to one of our other speakers. So I do want to point out that there was no one place across all of the Red Cross Red Crescent movement for COVID-19 content. Prepare Center was just one place. There were there's content across a number of different platforms. So we had Soconi, we had the learning platform, IFRC Go, and FedNet all also had content that they were hosting relating to COVID-19. So we were cross-promoting all of those different platforms on our platform to make sure that people were still able to find and locate the content they needed. One of the things that I really want to emphasize right here is there are a lot of moving parts in this. A lot of different people were involved in making this happen. We had a lot of different working partners at IFRC, at least I think 10 or 12 different teams and multiple people on each team, plus partners at some of the other reference centers, at some of these other hubs that I mentioned, plus our volunteers and staff who were helping to do a lot of the building of the sites and populating the documentation, tagging it correctly to make sure that it was easy to find. And our mobile vendors, our website vendors, of course, who were helping to support this process, both on the old website and on the new website at the same time. So this went live in mid-May, which is like right as the new Prepare Center, early May, I guess, just as the new Prepare Center website was launched, the COVID-19 Compendium launched along with it. And then just briefly, so that you can have an illustration of the traffic and the number of people that we were able to reach with this. We have a number of different types of content on the Prepare Center website. So here, this is the COVID-19 Compendium and the associated documents. And then we had the Health Help Desk, the BCP Help Desk, the Kids Kit, which we'll talk about in just a minute, which ended up being extremely popular. And then some individual topic pages that are sort of part of the regular knowledge management that Prepare Center provides specific to COVID-19. So across all of these different types of COVID content, these are the page views that we saw just for 2020. So this doesn't include 2021. This was just in the year 2020. You can see the number of page views. We have the Kids Kit here topping out in the 14,000 range of page views. And so the sort of red colored, coral colored bars represent the total number of page views, and the blue ones represent unique page views. So that's unique visitors to those pages. So Kids Kit is over 10,000 unique views. And then Health Help Desk, well over 10,000 page views, and in the neighborhood of 8,000 unique views. So we were getting a lot of traffic with this content. And then finally, the last thing I'll share before we go do a couple of questions is as a percentage of the content. So just so that you have an idea of how much people were engaging, this is all of the COVID-19 content on the Prepare Center website. Of that, you could see that the Kids Kit and the Health Help Desk were extremely popular resources. So the Kids Kit, which Bonnie will speak about in just a minute, got a great deal of traction. There, partly because there was not anything else like it that was going on. But then the Health Help Desk, and it's important to note that the Health Help Desk statistics don't necessarily include individual views of individual resources. It's views of the help desk itself. So there are more visitors on individual resource pages, but this is based on the overall views of the help desk itself. So I'll pause there and open an opportunity for questions. If anybody has questions, you can feel free to raise your hand or put them in the chat. And we'll just open it up for a couple minutes for questions before we move on to the next section. So apart from the BCP help desk, is there any help desk for PER? We don't host a help desk for PER on the Prepare Center website. There is a lot of PER content on Prepare Center because it's something that GDPC does a great deal of work on. And some of those elements, some of that documentation is included in the COVID-19 Compendium, but we didn't have a separate section or a separate help desk for PER. I'm not sure if that answers your question. Okay, great. Any other questions? Okay. Well, if you come up with additional questions, please feel free to put them in the chat, and we'll either answer them in the chat or we'll answer them toward the end. But we'll now go ahead and move on to the next section.
So enough of the theory and the technicalities. It's great, but we are practitioners. So we thank you, Jessica, for this great overview. It's always amazing to hear about this experience. And I'm sure that our attendance is enjoying the conversation as much as I am enjoying it. So right now we are at our last section, which is perspective and lessons. On this section, we will talk about 2 use cases, and then we will talk about the future and our vision for the future of knowledge management in these contexts. So we will start right now. Next slide, please. So we will have two speakers. We will have Dr. Lauren Clark from who is an emergency health officer for clinical services at the IFRC, and she will be talking about the health help desk that Jessica has been teasing all along. And then Bonnie will, who is our colleague, Bonnie Haskell, which is our technical advisor at the GPC. She will be talking about the Kids Kit Kit. So Kids Kit, excuse me. Without further ado, I'm handing over to Dr. Lauren Clark.
Thank you. I hope you can all hear me okay. Good evening from Geneva. So yeah, my name's Lauren and I work within the emergency health team at IFRC. And my background is as a medical doctor, so I very much work on the clinical services side of things. And so the health help desk has really been kind of like a big part of our job, and particularly managing all of these resources and questions that were happening at the beginning of the COVID pandemic. I unfortunately wasn't working with IFRC at that point. I was actually slaving away on a COVID ward in the UK for about 6 months before I joined. So I've gained some interesting insights from my colleagues who were here at the beginning of the pandemic. So as was previously said, the health help desk began within those first months of the pandemic with the purpose of kind of translating these existing highly technical documents, talking about all this misinformation going around. I was very much aware of, do we wear a mask? How do we wear a mask? Should we be wearing masks if we think back to that initial kind of March, April of 2020? And what we wanted to do was have a place where we could put all of this information and reference people to. I was speaking to my colleagues who were the only two working within the emergency health department at the time, and they were being inundated by emails from national societies, from other people within IFRC, where as just two people, you can't field that many emails, and having to keep track of, you know, what guidance is the latest, what have WHO released. So the importance of this health help desk, as is being shown on the screen, is to have this place where everything can be stored and we can just tell people, go and have a look on the health help desk, or here's the link. A really big thing with kind of the mismanagement of COVID-19 information was we wanted a place where we could say, here is the latest up-to-date guidance from IFRC. And in particular, when there was a lot of misinformation about masks and even more recently about vaccines, we needed a place where myself or any one of my colleagues could go through, look up all the latest information from reputable sources, whether that was resources we created ourselves or from WHO. And we can put them here and tell national societies, please look here first. And then if you have any further questions, have a look at our frequently asked questions, which are also within the health help desk. And if still your answer isn't given by us, we have an email address, which I will post in the chat, that anyone can contact us on. Still now, we occasionally get questions, and we've had quite a few with regards to kind of like the vaccine and things as well, which we then post in our frequently asked questions there. We still update the health help desk fairly frequently, and it was one thing that Jessica was saying is that we have all been trained to kind of do it ourselves, which is brilliant. So I can log on to the system and just re-upload some of the documents that are maybe a little bit out of date, or delete documents. Or one thing I've been doing a lot of work with is with GAP, who are based in Australia, who are very much involved in the movement's blood, whether that's blood transfusion guidance or helping with blood donation and collection in various countries. So we have a whole section, as you can see there, on blood services that GAP have been very heavily involved in. And actually thinking about kind of like the wider health, my department's quite small. We are emergency health, which COVID at the time has been very much, you know, a big part of our job. But also as well, we reached out and we lent on other counterparts within the health and care department. You'll see that there's like a lot of guidance on things like community health, volunteer and staff wellbeing, preparedness, the PGI side of things, which we're not experts in, and that's not what my job really entails. So being able to kind of bring in these experts from other parts of the health department has been really, really good for us to kind of gain more insight into it. And kind of the structure of the health help desk, again, we were thinking, what are the most common things we're being asked about, and can we group them in a certain way? So obviously we have things like vaccination, clinical pre-hospital care, PPE. So what we did was worked with these wonderful guys at the with American Red Cross and within Prepare Centre to be able to actually design it so that we have like a very good table of contents, so it's incredibly user friendly. Very, very infrequently are people unable to find things, and that's normally an error of my own where I've uploaded something in completely the wrong place and I just need to go back in and revise it. We have made it really interactive. We've added like a little quiz at the top as well for people to test their knowledge as well, and the FAQs is still the top of the page as well. So people are thinking like, how did we actually get this out and people aware of it? Because even still now we're getting questions about COVID-19 every week into my inbox. So initially what happened is national societies were made very aware of COVID and this help desk through emails, webinars. We have working groups within our kind of clinical side of things where we disseminated a lot of this information, and it very much filtered down from there. The nice thing with this as well is it's allowing, because it's open for everyone as well. I know other people have been directed to it from smaller NGOs that maybe aren't involved with the Red Cross, Red Crescent movement as well. So it's very much got out there into the public that this is a fantastic resource and a great place that you can find a lot of detailed information that has been fact-checked. It's been approved by us, whether or not we've written the guidance on masks ourselves or we've sourced it from somewhere else. And kind of like the thing, when I'm thinking about the challenges that we have had with the health help desk, is initially it was probably like the design and how much do we put on here. And I think, and I hope from people using it, that we've done quite a good job at keeping it simple. And chatting to my colleagues at the beginning, people wanted a lot on there and wanted it to be expanded really quickly. But in essence, we've kept it really simple and tried to keep the most important topics on there, with the knowledge that actually now if we start getting demand for other things, we can very easily expand it. But it's very, very difficult to make something absolutely huge and we can't manage it within our day-to-day work, and then it's harder to reduce down. So we've tried to do a really good job at keeping everything really concise and relevant on the website. Any questions at all? No. It's useful to go and have a look on there for everyone, particularly if you're involved in at regional level or national societies. COVID isn't going away anytime soon, as we all well know. So it's a useful resource just to make yourself aware of. So if someone does ask you a question of, oh, where do I find guidance about X, Y, or Z, you can just direct people into that way. Any questions?
I think I'm gonna add something to Dr. Clark, if you don't mind.
Of course, go ahead.
Yeah, while I was sharing screen, I hope folks in the attendance have seen the feature that is select language. So if you are from a national society that don't necessarily speak English, you can pick the language, and since it's on the page, the resources will be translated to your language. So this is also important in localization and the spreading more the information. And without further ado, I'm gonna introduce my colleague Bonnie Haskell, who will be speaking right now about a favorite of ours at the GDPC, which is the Kids Kit. And you will know later because we will be sharing a video that is so catchy that you will remember it for days.
Thank you,
Bonnie,
Nazreen.
over to you.
Thank you. Thank you for that wonderful introduction. And thank you, Jessica and Lauren, for the interesting presentations. I'm going to start to share my screen. And while I figure that out, Lauren, I just want to say I love the quiz feature of the Health Help Desk. That's wonderful. I'll have to play that. And let's see if I can figure this out. Share and then present. All right, can you see that, the kids activity kit? All right, great. I'll be talking today. Well, first introduce myself. I am Bonnie Haskell, a technical advisor with the GDPC. I work on different community preparedness programs at the Global Disaster Preparedness Center, but I also work very specifically on youth preparedness. And one of those activities, one of our recent activities, specifically during COVID and still ongoing, is the Kids Activity Kit. And it is a joy to be here presenting on this, because I don't know if you're allowed to have favorite programs, but this is one of my favorite programs with the GDPC. And so it's a pleasure to be here and joining you all. And there we go. This came out of awareness and hearing a lot from national societies and just from people in my own personal circle about educational challenges. As everyone is aware, is that there were school closures worldwide. And yeah, COVID just had a significant impact on education as a whole. It was not just a health crisis, it was an educational crisis as well. And as we were hearing from people were really struggling. They were homeschooling, or they were trying to homeschool. And they, at the same time, were trying to learn how to communicate about safety actions to their children. And also at the same time, parents and just those in their household were trying to maintain their jobs and their everyday activities while also keeping their children engaged. So how can children have fun? How can children still learn about how to stay safe during COVID and preparedness response actions? And how can they still continue to learn and keep that repetitive nature going? And at the same time, we were hearing that there were a lot of activities out there. We talked to our partners at Save the Children, partners at UNESCO, UNICEF. We all have different activities, but they were hosted in so many different places. And some of them were very similar activities, but they were tough to find. I talked to some friends and they said, yeah, I found a PDF on a website here. I found something on Twitter, but they were looking for one place where they could find a lot of activities and coming from trusted sources. And then a couple of other educational challenges were kids' understanding of how to stay safe during COVID. We see a lot of great posters out there, but there were other ways. We were trying to explore other ways to communicate preparedness to kids that they could understand through different educational levels. And then very importantly, so how to communicate about mental health. You might have seen, I know Google released their different search queries, and they were saying at the beginning of COVID, most people were searching about preparedness actions, but it slowly started to shift and go into people searching about mental health. And then parents were struggling or wondering how to communicate about mental health to their children. How can children process a lot of the emotions that they were feeling? So this led us to think and explore with different partners, both internally and externally, on how to create that one site where there could be activities, how to bring together all of our activities and communicate it in a fun way across these different topics, across preparedness response, and also on mental health. And that led us to the Kids Activity Kit for COVID-19. And we created different topics, one being safety activities. And these activities were about social distancing. They were about wearing your masks. They were just about washing your hands. And then we had wellness activities. And these were the mental health activities, how to keep yourself just feeling good and feeling well during this time. And similarly, or attached to that, we had acts of kindness, how to promote kindness to others during such a difficult time. And just in general, a lot of these activities are just general activities that could be appreciated even outside of COVID. And these acts of kindness were just treating other people so they can feel well and safe as well. Then we have Imagine and Create. These were activities that we felt, we're doing a lot of safety activities, but this is also a time for kids to be imagining a new future. What would that look like for them, and how could they create it in an active way? So we created some Imagine and Create activities as well. And then, because we're the Global Disaster Preparedness Center, we have different applications, mobile apps and different games related to disaster preparedness. If kids are at home, they can download those apps or they can start playing those games and prepare for other hazards as well that do happen despite COVID happening as well. And we created these cards. There's one on the right there, which is called 6 feet apart or 2 meters apart. And I know that guidance has changed over time, but this is one of the cards we created at the very beginning. And we decided to create different, them in sort of cards that could be shared, sort of postcard size cards that could be shared across social media. That was our main channel. But I know a lot of parents were sharing them across Facebook and Twitter, and also across WhatsApp and on email as well. So we wanted to create them in very easy to share cards. We wanted to make them colorful. As you can see here, we tried to maintain a very calm color palette. And we also had wonderful volunteers that helped create the designs, create the characters that you can see there. And then we tried to start with different key messaging, but also ask some questions so kids can reflect and have an activity as well. And at the end, share with their parents or households or friends about what they learned, and also to explore together how to continue to stay safe. And we really wanted these to be interactive, fun, can be done together, but also maybe by yourself if that's the situation you're in. And also just something that they want to keep repeating. You know, kids learn by play. It's the pedagogy of play, and they learn by repetitive nature. So if they like the game, if they like the activity, hopefully they start to repeat it and they start to learn through that means. And so we do, as many of our kids' activities do at GDPC, we have the pedagogy of learn, practice, share. They're learning the protective action. They're practicing it through play when it comes to these activities, and then they're sharing it with their households. And yeah, we had many volunteer contributions. I just want to give a shout out to our volunteers. We couldn't have done this project without them. And also to Miguel, who is a communications expert at IFRC. He was with the GDPC supporting this project, and he is also online as well. So I'm glad he could join. And okay, I'm going to exit out of this screen. And I wanted to share with you a couple of the videos, because actually we started with cards, but we realized one of our challenges was that not everyone was going to learn through a card format, or they weren't going to just, some people go to YouTube, or they learn through radio clips. So we wanted to create multimedia around the success of these cards. As you could see from what Jessica showed, we had many views. We had close to 14,000 views. And close to 10,000 unique views of our cards just by spreading the word through social media. So we thought, you know what, there is demand there. How can we continue to supply? And so we created these videos and audio clips, both in English and Spanish, exploring maybe adding more activities in more languages as well. And so I wanted to share with you, let's see if I can make sure that you have sound. If not, then hopefully Nesreen could help me out. But one of our activities called Soap versus Germ, which is, we think it's a fun activity you'll learn for yourself. And maybe I did this activity on my own after I learned about it. But we ended up getting 27,000 views or 26,000 views on this. And so we think this is one that's been very popular. So let me share my screen. Please let me know if you can't hear it.
Bonnie, I think you need to share sound. So unshare and then share sound. Or if you want me to do it, I can do it.
Okay, 1 second. All right, I shared computer sound. Here we go.
Safety activity! Soap versus germ. Ever wonder how soap actually fights off germs that make us sick? Try this science experiment. Get 3 things: dish soap, a bowl of water, some black pepper. First, sprinkle pepper to cover the water's surface. Next, put soap on the tip of 1 finger. Boop! Touch a surface with 1 soapy finger and 1 not soapy finger, and see what happens. Drum roll! The finger without soap is covered in pepper. The finger with soap pushed it away. Just like soap pushes germs away. Ta-da! Are you ready to be a scientist? Try this yourself.
All right, so that's one of our videos called Soap versus Germ. Just in case you're wondering, that activity does actually work. I love that activity. We created this in partnership with Save the Children and also in partnership with UNESCO, UNICEF, Plan International. There were many partners involved in creating the whole kids kit. but specifically this video was created with American Red Cross, GDPC, IFRC, and Save the Children. And it can be available on our Kids Kit site that I know Nazreen had shared earlier. And this also follows the mentality of hoping that kids learn by repetition, by catchy tunes, and also at the end, asking them a question. Are you ready to be a scientist? Are you ready to do this activity? We really want to catch their attention and engage them. And then I wanted to share one, if we have time, one last video. It's very short. And I wanted to share this one because this is a tried and true activity that I know other Red Cross and Red Crescent national societies have used. It's called Breathe with Color. It's a mental health or a mental wellness, a well-being activity. And I think it's very calming. So we could leave you with that as well. So I'll share this one.
Can you share the sound? We can't hear one.
Yeah, it says computer sound. So I don't know why that one's not working. Are you able to share that one, Nazreen?
Yes, one moment.
All right, thank you. Sorry for the technical difficulties. It's worth it. It's a nice video.
Okay, is everyone able to see my screen?
Yes, I can see it.
It's Breathe with Color, right, Bonnie?
Yes, it's that one.
Okay.
Safety activity.
Sound is working?
Breathe with color. Ever feel worried or scared? Like you want a superhero to save the day? Try this. Think of your favorite color to be your good feelings. Something like sunshine yellow. Next, choose a color for your not so good feelings. Maybe stormy gray? Now, breathe in and imagine your good color filling you up with nice feelings. Next, breathe out and picture your not so good color blowing away. Feels better, right? It's like your own special superpower. You can be your own hero. What color is your superpower?
Great, thank you, Nazreen. So that was one of our many mental wellness activities. And yeah, I just wanted to show you 2 of the different videos we made. We ended up making 6 videos in English, 6 in Spanish. Again, we're trying to explore ways to expand this kit. We always leave it open to activities that other national societies have been working on, and how can we work with you to make a card that we can share. We're still doing social media campaigns, or maybe even exploring videos of these cards, of these activities in the future. This has been very successful with national societies that have been looking for youth and children programming and content for COVID-19. And so this has been particularly shared in Latin America, and we're hoping, and also with some French-speaking countries as well. So we're hoping to also hear feedback from other national societies if they find this useful, if they have activities they'd like to see in terms of the card format, or any ideas you might have on creating new activities. We can do that together. And so we've learned a lot from this project. We hope that you find it useful as well. We're always open to collaboration. So I'll leave it there. We can also open it up to Q&A if you'd like. Thank you.
Thanks so much, Bonnie. I absolutely love the Kids Kit. It's so much fun. It is so much fun to watch and to work on. And I find some of the activities like breathing with color, like you said, to be relevant to adults as well as kids. So if anyone has questions, please feel free to raise your hand or put them in the chat. We've been putting links in throughout so that you can check out all of these resources on your own as well. Give it just a second, see if anyone has questions, and then we'll proceed with the final section of our talk today. Oh, I can't see the chat anymore. There we go. Great. All right, well, go ahead and feel free to put in questions anytime you have them, but I'll go ahead and proceed with the next section of the presentation with Nazreen.
Thanks, Jessica. So in this section, we will be talking about the lessons learned. I think you figured many of the lessons already, but it's always good to do some repetition, as Bonnie mentioned earlier on. So a lot of lessons were learned, whether through the challenges, whether through the successes, but certain things really stood out. So the first one is partnership and true collaboration are invaluable and necessary in this context, especially in the context of a pandemic where everyone is stressed out, when it's something that is unprecedented and is on a global scale, something that we've never seen before. So it's the unknown. So how are we gonna deal with it? Deal with that. So that's why I mentioned the word conscious when I shared with you the definition of knowledge management, because when we do true collaboration and genuine collaboration, that's something that is in the benefit of everyone, and that's something that help us grow together and tackle these issues together as a movement, as a united front. So having a growth mindset is really important for these types of operations, because we cannot expect to achieve perfection in this instance, but what we can strive for is genuine service to the communities. And for example, a project or an initiative might not have the best web design, or might not have everything on it, but at least we're doing the work and we're striving for doing it well. And we hear and listen, we listen to the user feedback. That's why for example, in the chat, I prompt some of the attendants to share your feedback with us, whether it's via Twitter or via the email. We listen to your feedback and we take it very seriously, and take that into consideration in our day-to-day work. Curate, and finally, again, curate. Digital curation is something so important, especially now that we are, well, not everyone is working from home, but a lot of people are privileged. Actually, it's a privilege to work from home, but still, we are saturated with information and with misinformation, as Dr. Clark mentioned earlier on. So digital curation is super important, and it's part of the best practices of knowledge management. And that's why the work of Dr. Clark and her team, or the work of Bonnie with the Kids Kit is super important, because it's an act of curation, and it's something that always, and digital curation is super important, because in this mass of information that is online, being part of the Red Cross, Red Crescent is super important, because we have the brand, we have the authority and the legitimacy. So it's good for us to share the information that could be useful to our communities. Next slide, please. And over to you, Jessica.
Right. So one thing that I think is a good question to sort of ask ourselves when we're trying to learn from a process is, what if we had to start over again? With the benefit of hindsight, what would we do differently, knowing what we know now? And what have we been able to learn from this process that we can apply to continue to improve? So Nazreen and I have had multiple conversations about this, sort of the things that we can learn from the process. And if I knew then what I know now, what would I have done differently? So I want to highlight a couple of these elements from the hindsight, from the perspective of hindsight. And Nazreen, please feel free to jump in on any of these that you'd like to jump in on. So one of the first, well, actually, I'm going to put you on the spot for technological literacy, and then I'll jump into the other ones.
Yeah, I thought I would rest my voice a little bit, my soprano voice. Just joking. So for technological literacy, it's really important to consider that not everyone is well versed technologically, and whether it's a child or like teenager or adult, age has nothing to do with it. It most of the time it's a matter of means and privilege, but that's another topic. But when it comes to technological literacy, we really would have, ideally it would have been better for us to prepare beforehand admin guides for the onboarding. So and it would have saved us a lot of back and forth emailing or like unnecessary meeting when we are already overwhelmed. Does not mean that we don't like meeting with our colleagues, but it means that it could have been a way to better manage our time and energy, especially in this unprecedented context. So for technological literacy, and this is something that we are currently working on, we are preparing admin guides for the users for the several type of users that Jessica mentioned earlier on in the presentation, like the microsite editors, the authors on our website, and also for the onboarding. So filming tutorials. So there are people who are visually impaired, so they need audio file. There are people who are more of a visual learner, so we are filming tutorials, recording screen, and showing them step by step what to do. So this is what we mean by technological literacy. And over to you, Jessica.
Yes, thank you. So the next one is flexibility. I feel like this is something that we know somewhere in our brains, but it's very hard sometimes to actually behave in a really flexible way. But the necessity of this context, with the challenges of COVID, with a rapidly evolving situation, with changes in the priorities of national society, changes in the technology that we were working on at the time, changes in who's responsible for which pieces. There's so many different things that were changing, and a very rapidly evolving context in terms of the content being generated, the guidance that needed to be shared. It was so important for us. It was so important for us to be as flexible as possible. A lot of us are very used to working in our comfort zones, working in our modalities that we apply all the time, and modifying that and being comfortable with things changing, being comfortable with the fact that, maybe we completely designed a whole page and then the next day we're actually not going to use that page. We're going to point to another place, and because it's a better resource that's already been built, and being flexible with some of those changes, and, understanding that in this kind of context in particular, that's constantly changing, that change is inevitable and you need to be flexible to meet those needs. So do you want to go back and forth, Nazreen? Do you want to do user-driven approach, or you want me to do that one?
Yeah, could you do that one? I'll talk about taxonomy.
Sure. So one of the things that we're very conscious of at GDPC across all of the digital tools and other tools that we work on is it's important to take a user-driven approach. And in this case, it's interesting because we sort of have a couple of different users in mind from where we're sitting at the GDPC. One of them is, of course, the users of the website, the people who are visiting Prepare Center to locate and make use of this guidance and this information. But on the other hand, we also very much view the IFRC partners and the people who are helping to manage microsite content as our users, because we're helping to support activities that they're doing as well. So we had to have sort of a focus both on the end users of the website, but also the people who are using, quote unquote, the back end of the website to manage their content, to be able to present the information that they wanted to present. So taking into account both of those perspectives at the same time, I think was a key role that GDPC could play in this space, because we already had a really good understanding of what Prepare Center and Prepare Center users were looking for and how they might navigate to the site, having a good understanding from that website perspective, and then combining that with the IFRC knowledge of who they imagined their users to be, but then also, how they needed to be able to make use of the site and the design aspects and editing themselves. So those are the approach that we were taking. It wasn't just about one type of user, it was about multiple different types of users.
And since Jessica was just talking about the type of users, this leads us to taxonomy and metadata. I know it's a little bit technical here, but it's also really important to make sure in hindsight that tagging the resources with relevant metadata is extremely useful, especially when there is a lot of resources and a lot of information, because it will make I'm tempted to say the life, but it's not a matter of life or death, but it will make it easier, not only for the person who is uploading the resources, but also for the end user, not to find the resource or to upload it and to tag it properly in a way then that is searchable and easy to find. So, and also for search engines to crawl the website, and it's easier for it to reference that, so people can find it more easily when they just, for example, do a Google search. And over to you for data analytics, Jessica.
Yeah, this one is definitely one of my pain points in this whole process. So prior to the introduction of microsites, and prior to the building of the COVID-19 Compendium and the associated help desks, the only people who really ever looked at the analytics for the website were internal GDPC staff who just needed to understand what the traffic looked like coming to the site, what were the most popular pages, how are people coming to the site, what paths are they following, what are their demographics. We used to look at those things a lot when it came to just management of the site and understanding how our users were behaving. When it came to the COVID-19 content, first of all, the amount of content that was being accessed relating to the same topic it basically spiked a great deal. We had a lot of new content, we had a lot of new users, a lot of that related to the help desks, related to the kids kit, related to the compendium. And not only did we need to be able to understand that, but we needed to be able, as GDPC, thinking about maybe our clients being, the emergency health team or other partners at IFRC, or, Bonnie managing the kids kit. We needed to be able to help share those analytics with our team, with our partners, to help them understand how people were engaging with their content. And that was not something that we anticipated well. So that is definitely something that we've learned through this process, is to really be thoughtful when it comes to the technology and the analytics and users engaging with this content, thinking in advance about how we can more easily understand and share understanding of that data that's coming out, because we have a lot of analytics through Google Analytics that we're able to look at for the website, but setting it up in a way where we could very easily, go to Lauren and say, okay, Lauren, in May, this is what we saw in terms of engagement with the, with the help desk, or Bonnie, over the course of this year, here's what we were able to see with engagement with the kids kit, and really be able to hone that view of the data that was specifically related to these different components that the different teams were helping to manage. We didn't have a good way to do that. And we've done a lot of thinking and a lot of changing in the way that we approach our analytics for the website, so that we can better meet those needs now. Because I will tell you, I went through a lot of manual processes, especially in 2020, where every month I was reporting on the traffic to each one of these different areas of the Prepare Center website. And it was a very manual process, because I had to go in and essentially export a whole bunch of data into a spreadsheet and then manually tag everything based on whether it was part of the help desk, whether it was part of Kids Kit, whether it was part of something else, and be able to share that information externally. And it took a long time, and it was labor intensive. It was a manual process, and we've learned a lot from that to help us set ourselves up for success in the future for other needs where we're in this situation. So that was definitely a pain point for me. That's something that we with the benefit of hindsight absolutely would have set that up differently from the beginning. So I'm going to move on to our last slide here, which is about the future. Thinking about this experience and thinking about the rebuild of Prepare Center and this sort of test case. This COVID-19 Compendium was really a validation of our microsite concept, and it was I hate to use these kinds of terms, but it was like trial by fire. It was like, you need to set this up right now. It needs to be good. It needs to be useful. We didn't have the luxury of doing this very slowly. We stood up our first microsite as soon as we could possibly set up our first microsite, and it had to work, and it had to be good, and it had to be useful, and it was. And so it's sort of that this COVID-19 Compendium and the associated pieces really validated our concept of the microsite as a workable model. And since then, we have expanded our utilization of the microsite model. I can let Nazreen talk about that a little bit. She mentioned it earlier that we have a number of other microsites that we've been working on, but we've learned a lot from the partnerships that we worked through during the COVID-19 process, or have and continue to work through, and we've really utilized those learnings and how we approach those partnerships for the microsites that we've been building since then. Nazreen, do you want to cover these other ones and then we'll wrap up? Or maybe I can. Oh, there you go. Okay.
Yeah, sure. You froze a bit. My internet was a bit unstable. Do you mind reminding me where you were?
Yeah, so I basically talked about the innovation and partnerships piece. Do you want to talk about processes and then we'll wrap up?
Yes, I'll do that. Thanks, Jessica. And the joys of unstable internet. You froze for a second. So when it comes to the processes and our vision in the future, so as you might have noticed earlier on, we talked a bit about having like the technological literacy, and I've seen a comment from Wineford. I hope that I'm correct pronouncing your name correctly in the chat, reiterating that and reinforcing that thought. So now we are currently we recruited volunteers to support us with the work on the website, and especially for the admin guides, recording tutorials, and having that ready for the users, whether they are the end user that need onboarding like everyone else, or they are the people who are editing or the editors on preparecenter.org. And in terms of documenting when it's possible, sessions like these are a great opportunity to pause and reflect on what we've accomplished and what we've done, and having discussions with our partners, like for example, Dr. Clark and thank you again for being here, with Dr. Clark on their experience using the website and how we can improve. That's something great. So we are currently streamlining this process to make it as easy as possible for the users, whether it's the end user or the user of the website, to enjoy their experience on preparecenter.org.
All right, well, that brings us to the end of our presentation. We still have about 9 minutes left in this session. So if there are questions or if there's any discussions that any of you would like to have before we close out, we'll open it there. I'll also give the opportunity for Lauren or Bonnie, if there's anything that you want to add or ask, you're welcome to also do that at this time. But if anyone has questions, comments, anything you'd like to discuss before we close, I open the floor for that.
While people are thinking about their questions, and I hope they have many, maybe I I can invite Miguel, if you don't mind, to talk a bit about your experience, because Miguel was a huge part in this compendium. So Miguel, if you're here, I'm sorry for putting you on the spotlight. We always
No problem. Thank you so much. Thank you so much, Nasrina and Jessica and Bonnie. It's great how you all sum up all the work, and it was pretty intensive, and I'm very glad that I can see the results now. Bonnie just shared the outcomes, the statistics, and I can't believe how starting from ideas, from some diagrams, some scratches, and now it has evolved on very good initiatives, and I'm happy to share all this experience and happy to be involved as well. So congratulations. I'm looking forward for more steps. As you can see, I think the more important lesson learned here is that everything can be improved, and it's great how everything has evolved in the help desk, in the kids kit, and the BCP help desk, and according to our users' needs, and everything will change probably, and more guidelines and more things should be uploaded on the Prepare Center site, and invite all the people who's attending right now. Use the Prepare Center site. It's a very good way to access the resources in a very easy way, and make the best use of it, because the Red Cross, Red Crescent National Societies, we need to use a really important resource page to have all our activities and our guidelines, because people need to see what are we doing, so people can also replicate our best, our lessons learned and our best experiences. So cheers, congratulations to the GDPC.
Thanks, Miguel.
Yeah, thank you so much. So I don't see any questions in the chat. So I think we'll go ahead and wrap up for the day, or for today's session. Thank you all for joining us. It's been a pleasure sharing this experience. We definitely, you know, as with everyone else who's been working during the COVID pandemic, we had a lot of moments of stress, but also a lot of moments of success, and being able to, you know, to do good work and share good information. And, you know, there's a lot of things that we've all learned in the last couple of years as we've navigated this space. And I'm really happy to be able to share our particular experience with you. We have our email address that we've also put in the chat. It's gdpc@redcross.org. So if there's anything that you would like to follow up with us in the coming days and weeks, we are absolutely here to answer your questions and to continue this conversation outside of this week's presentation.
Yeah, and also if I can add, I hope you'll enjoy the sessions in Planet Red. This is a great summit, well organized and well thought of. So kudos to all the organizers. You will also find, I hope, if we do it correctly, the presentation uploaded on the platform, so you can download it and use it as you please. And thank you for your time and for being here.
All right. Thanks so much, everyone. Have a great rest of your day, or great tomorrow, depending on your time zone.